Well, today, we're shedding light on a specific type of cataract uniquely associated with myotonic dystrophy, a genetic disorder that affects muscle function. This isn't your run-of-the-mill age-related cataract. It has distinct characteristics and implications for individuals with myotonic dystrophy. Join us as we explore the intricacies of myotonic dystrophy-associated cataracts, from their causes to management strategies. Myotonic dystrophy-associated cataracts aren't directly caused by age or typical cataract risk factors. They are a direct consequence of the genetic defect responsible for myotonic dystrophy. This defect, typically an expanded CTG repeat in the DMPA gene for myotonic dystrophy type 1, or a CCDG repeat expansion in the CMBP gene for myotonic dystrophy type 2, leads to abnormal RNA processing. This abnormal RNA processing then affects various cellular processes, including those within the lens of the eye, ultimately leading to cataract formation. So, the root cause is the genetic mutation that underpins myotonic dystrophy itself. The pathophysiology behind myotonic dystrophy-associated cataracts is complex, involving altered cellular processes within the lens. The genetic defect disrupts RNA splicing and processing. This results in the abnormal production of proteins which are essential for lens transparency and structure. Specifically, the disruption affects the lens epithelial cells and fiber cells, leading to changes in their shape, protein composition, and overall function. Over time, these changes cause the lens to become opaque, resulting in the characteristic star-shaped or polychromatic iridescent appearance of these cataracts. Myotonic dystrophy is a relatively rare genetic disorder. Consequently, myotonic dystrophy-associated cataracts are also not commonly encountered outside of individuals diagnosed with myotonic dystrophy. Prevalence varies depending on geographic location and the specific type of myotonic dystrophy. It is estimated that a significant proportion of individuals with myotonic dystrophy will develop cataracts, often at an earlier age than those with typical age-related cataracts. The specific age of onset and severity can vary considerably. Unlike typical age-related cataracts, myotonic dystrophy-associated cataracts often present with unique features. One characteristic sign is a Christmas tree or stellate appearance with iridescent, polychromatic crystals within the lens. While blurred vision is a common symptom, similar to other types of cataracts, individuals may also experience glare or halos around lights. Due to the systemic nature of myotonic dystrophy, other symptoms such as muscle weakness, myotonia or muscle stiffness, cardiac abnormalities, and endocrine issues may also be present. Diagnosing myotonic dystrophy-associated cataracts involves a comprehensive eye exam by an ophthalmologist. A slit lamp examination is crucial for visualizing the characteristic features of the cataract, such as the stellate or polychromatic crystals. Additionally, a thorough medical history is essential to identify any known myotonic dystrophy diagnosis or family history. Genetic testing to confirm the presence of the DMPK-CMB gene expansion is also necessary for definitive diagnosis of myotonic dystrophy, and by association, the likely etiology of the cataract. While cataracts in general are often classified based on their location within the lens, e.g., nuclear, cortical, subcapsular, myotonic dystrophy-associated cataracts aren't typically classified in this manner. The crucial distinction lies in their etiology, the fact that they are directly linked to myotonic dystrophy. Therefore, they are identified and managed specifically as a complication of this genetic disorder. The primary treatment for myotonic dystrophy-associated cataracts is cataract surgery. Phacoemulsification, a common technique where the clouded lens is broken up and removed through a small incision, followed by the implantation of an intraocular lens, is generally effective. However, special consideration is given during surgery due to potential muscle weakness and sensitivity to anesthesia common in myotonic dystrophy patients. Careful pre-operative assessment, gentle surgical techniques, and appropriate anesthesia management are crucial for optimal outcomes. There is currently no non-surgical way to reverse cataracts. Since myotonic dystrophy-associated cataracts stem from a genetic condition, there's no direct way to prevent their development. However, genetic counseling can provide valuable information to individuals with myotonic dystrophy or those with a family history of the disorder. Early detection and management of myotonic dystrophy, along with regular eye exams, can help to monitor cataract development and plan for timely intervention when necessary. Protecting your eyes from UV light can also contribute to overall eye health. The prognosis after cataract surgery for myotonic dystrophy-associated cataracts is generally good, with most individuals experiencing significant improvement in vision. However, the long-term prognosis is also influenced by the overall progression of myotonic dystrophy and its systemic effects. Recent research focuses on understanding the molecular mechanisms underlying cataract development in myotonic dystrophy, with the aim of identifying potential therapeutic targets for slowing or preventing cataract formation. Furthermore, Advancements in surgical techniques and intraocular lens technology continue to improve the outcomes and quality of life for patients with myotonic dystrophy-associated cataracts.